one of the things I find challenging in medicine is having people be enthusiastic as you about their outcome and to have a stake in their good health and take accountability for their health. And when you get somebody who makes a big life change as a result of your relationship or what you've spoken about, or of just educating them on what their condition is, you feel a lot of pride in being a part of that person's journey and helping them to get through one of the toughest things that they can experience, even if that means that they don't have the best outcome, but they have the best outcome for themselves. And sometimes pride comes in the form of having those really challenging discussions, even at the end of life, to help people to understand where they're at and how to make the best of the time that they have. From a personal standpoint, I think I feel a lot of pride in being able to serve our community. I think that I grew up in a household where my dad was a general cardiologist in the community, and he worked for 39 years in our town of Auburn, which is a small town. And we know everybody, he knows everyone. And you balance the fact that people can have a heart condition for 20 or 30 or 40 years and they're your neighbor and they never get much worse. But with my job, I only see people at really the end stages of their heart failure. And so you get a skewed sense of what heart disease is because of your specialty. And I think that I feel a lot of pride in being able to incorporate my experience in youth of seeing people actually do well and balance that with people who are at really end stages of heart failure where you're trying to salvage a bad situation and try to reconcile those two. And a lot of that comes in how you speak to patients about what their options may be, or being open about end of life and not being scared of having difficult discussions like that. And then I think my last thing is I am very proud of myself in changing over the last 5 years since I've been here. So as many people, you're trained a certain way when you have your own personal opinions about medicine and decision making and clinical decision making. And with a extremely scarce resource like a heart, you often have to make difficult choices and balance risk. And I think that understanding other people's opinions and perspectives on how to assess that risk and move forward has been really instrumental for me, because you think of things a little bit in tunnel vision. You have one way of approaching a problem and you realize that there's 100 different ways to approach a problem that you didn't even know existed. And it really opens your mind to people's opinions and just better understanding of the world.